Hi, now I want to continue what's biomedical engineering by examples. So I'm going to talk about biomedical imaging from several examples. First of all, what is biomedical imaging? Yes, it is an imaging technique to see a body and biological shape, morphology, and function. So let's start from anatomy side. So a good example for anatomical biomedical imaging is MRI, so magnetic resonance imaging. Or you have heard X-ray, you probably have taken it, and some of you may have taken X-ray, CT, or computed tomography. So for this, I volunteered myself, putting myself inside MRI machine to look at my inside of my brain. So it's in 2010, I volunteered when I was working. So this is my brain. Let's take a quick look. So this shows a planar view of my brain. And from the top to bottom, you see very interesting thing. And throughout my brain and the symmetry, it shows a lot of information, which I was very curious to watch this. So this MRI allows me to first time to see what's happening. And something interesting I found, this is my nose. And the guy who took my images showed, hey, you have this nose problem, this asymmetric. And I told him, hey, I have suffered like nose problem for a long time. And you see, this is a little asymmetric. And I was very concerned. Oh, I have nose problem because of this. But later I realized many people do not have perfect symmetry. So in fact, the symmetry is overall right, but I guess it's not something too worrisome. But however, this allows us to see inside our body, especially when there's a disease such as a tumor growing, or if I got a stroke and this, or hemorrhage, and this is a good way to see inside the body, even without any concern of radioactivity. So this MRI revolutionized medicine. Of course, I think it got Nobel Prize. So this MRI measured the response of atomic nuclei of body tissues by using high frequency radio waves in a strong magnetic field. So MRI measures and generates this in a strong magnetic field. It actually measured the atomic nuclei of the body, especially hydrogen and atoms. And that gives a very interesting contrast. And it's known to be very good for soft tissue contrast. On the contrary, X-ray, so you are probably familiar with this X-ray, chest X-ray. So you can see this X-ray is producing images of internal composition of the body by passing through the body with an X-ray. X-ray is a very strong, high energy electromagnetic wave, which is even called ionizing radiation, which can be harmful if we get too much exposure. And this shows that you can see these bones are notable, that these bones has more absorption of the X-ray. That gives us a contrast, especially it's good for finding out a fracture. And at the same time, this chest X-ray also gives a glimpse of the heart and some of these big vessels and the lung. So this it's a standard technique, and by measuring, imaging this absorption to a different degrees by different materials, X-ray produces a nice way of imaging. This X-ray is basically 2D. However, we can use X-ray to take even create three-dimensional imaging. So you can see an exquisite images, three-dimensional images from X-ray CT, and which is computed tomography. And using a contrast agent, you can even see the blood and blood vessels, not only the bone, which is obvious here, and you can see a very fine structure of blood vessels. So you can see not only the bone, the distribution of the blood vessel, and even the three-dimensional structures of the heart very clearly. Because X-ray has quite a short wavelength, it provides us a pretty high spatial resolution. So X-ray CT computed tomography scan is now a medical tomographic imaging. Tomo means a cut through. So it can basically create a three-dimensional image by computer processing of large series of two-dimensional X-ray images taken around a single axis of rotation. However, this X-ray usually provides anatomical information, while we also are sometimes more interested in the function of the tissue. So how can we measure the function of the tissue and why is it important? So let me give you an example. So there's a cancer patient who has a solid tumor inside the body, which was discovered and let's say detected on MRI, and also X-ray can show that. What if the patient undergo a chemotherapy treatment? So patient got this chemotherapy drug, and in fact, the tumor gets dead, and it doesn't, while the structure remains, it's also scar tissue. Then if a doctor sees through MRI, hey, the tumor is still there, you have to keep taking this chemotherapy, which is quite obnoxious it can be harmful for the patient, while he or she didn't realize the tumor is already dead while it was only a scar. So this gives us an idea that, oh, we have to better to see the viability of the tissue or this tumor, so that if it's already dead, we probably don't need the treatment anymore. So for this aspect, let's take a look at functional imaging and function and metabolism. So understanding this functions and metabolism of the imaged parts of the tissue or organ can be very important. So for this, there are a number of techniques such as called adding functional onto the MRI. So we call functional MRI or fMRI, and which is taking multiple MRI images while there is a functional activity, and that gives some contrast showing up by processing these multiple MRI images. The other example is so-called PET imaging, which is Positron Emission Tomography. So let's take a look first at these brain images. So people realize that when the subject perform a task, which is known to specifically activate a part of the brain, then indirectly the blood flow to that part from the neural activity, this blood flow changes, and we measure this MRI over and over and subtract. And that changes can be shown up in this, let's say, right part, left part, and this particular part of the brain can light up. And so this has revolutionized our understanding of how certain specific function or neural activity can be visualized inside the brain. So fMRI measures the brain activity due to changing neural activity via a mechanism called blood oxygen level dependent contrast. So this means this neural activity involves its hemodynamic need, which is supply of the blood, and that changes of the blood and blood volume can be detected by fMRI method. So this mechanism, you can name it as a BOLD, and we call it as a bold contrast. However, I have to say the bold-based fMRI do not see neural activity directly, because we are not looking at the neurons firing and neural activity directly, but of the secondary effect of hemodynamic changes. So it's still controversial that what's the true mechanism of fMRI, what is the smallest resolution of the fMRI. So there are still a lot of more to be investigated and reviewed. So the second thing is about positron emission tomography. So PET is a nuclear medicine imaging with 3D images of functional processes in the body. So what does the PET, why do we call it a nuclear medicine? Is PET system detects, in fact, ionizing radiation. So a pair of gamma rays. And this allows us to see this through and lighting up. You can see typical PET three-dimensional images will light up brain, which is the most active part in our body. And also PET tracers can be accumulated in the bladder. So the bladder also light up. And more importantly in here, this is a patient who has a metastasis, a tumor growing in the liver. And this image shows three-dimensionally where are these tumors are actively growing inside the patient body. So a viable tumor, actively growing tumor can be shown by using this PET technique. Another example is here. So this shows a heart, a cut-through tomographic view of the heart. So if a patient has a problem in the heart, such as right after heart attack, and we can take a PET image, see that there is a no blood flow in one part of the ventricular place. And then by using PET imaging, also we realize that there is no metabolism, which means that part of the tissue are probably dead and the patient needs a new heart. So there is a permanent damage and the patient needs a transplantation of the heart. While on the other hand, what blood flow is not there. So there's an incidence without blood flow, but using a viability PET imaging, this shows metabolic activity is still there. That means this part of heart tissue is still viable. So it's not too late, and to recover the blood flow, you can probably salvage this part of the heart. So this patient may need to go to bypass surgery, which will replace the problematic blood which feeds blood onto this part by this bypass surgery. So there are a lot of radioisotopes which can be useful for PET, but one thing I want you to remember is called FDG, which stands for fluorodeoxyglucose F18. So this is an analog of glucose for showing regional glucose uptake or tissue metabolic activity, because it's known that like a brain uses a lot of glucose for its activity. Also, a tumor needs a lot of uses glucose for its metabolic activity, and also heart as well. So now I want to give an example of my story, because I have been working with biomedical optics field. So optical imaging can be used for biomedical imaging. So this is an example. So when I was a graduate student, I had a chance to work with a startup company, which is looking for how to improve dermatology surgical technique. So let me explain you one thing. This poor figure shows that a patient suffering from the skin cancer. And to find this cancerous region and to resect it, you don't want to have a lot of safety margin on the face of the patient. So like upside, very important organ like brain or exposed part of our face, we want to minimize unnecessary cut. While cancer is so dangerous that you don't even want to leave any cancer cells behind after resection. So there is a dilemma. So showing you here with the skin there is a skin is composed of layers. The top outer part called epidermis, and inside is the dermis. And there is a visible lesion on skin, and dermatologists are suspecting there's a cancer here. So what they do is first, very thin layer of the skin is removed. And then that bottom part, which may contain tumor. So you flip it, you cut through, and then you examine it with a microscope to see if there is any remnant tumor in some part of this inside the part. So let's say he found one region here, still cancers remained, then he go back and take not the whole area, but only that part. So another thin layer is being removed. And then again, you flip it, you watch it microscopically to see if there's a still remaining cancer. So he found one and this part. So you remove another thin layer remove. And then until you repeat this until you don't see any cancer remaining. So this way, we're trying to minimize the resection of the skin, but make sure the cancer is being removed. So this is what's happening in the dermatology skin cancer clinic, and how, let's take a look what the procedure looks like. Removal of the skin, it takes, let's say, 15 to 20 minutes, and you send it to a lab for microscopic tissue examination, and that takes time for the staining while the patient is waiting. And then you found like another layers of tumor, remnant tumor, then you have to go back to this, repeat and repeat, and that takes a long time. And all cancers only removed, then the dermatologist will reconstruct the part of the skin, and this surgery is finished. So this is called Mohs surgery. So Mohs surgery procedure, also we call Mohs micrographic surgery. This is a precise surgical technique to treat skin cancer. During the surgery, thin layers of cancer-containing skins are progressively removed and examined until only cancer-free tissue remains. Yeah, the real issue is it takes time for the dermatologist, and also you need a laboratory personnel who are specialized to do this for as a staff. So what I have been asked to do is develop a optical imaging technique which may remove this external staining, which takes a long time for H&E called hemotoxylin and eosin stain, by just pure optical technique. So here comes a very rough draft of this idea. And I was working for a startup company who is working on this process. So this is called fluorescence polarization imaging device to improve Mohs surgery procedure. The idea is actually pretty simple. So this was licensed from Massachusetts General Hospital, a faculty there, and the company bought the license and tried to build it. So this is a simple diagram. The CCD camera watches the sample when the Mohs surgeon took out the tissue and upside down and put it here. What I want to do is illuminate the laser on top of the sample, but we know that the light electromagnetic wave has a polarization. So we control the polarization as an in-plane polarization and just orthogonal to the plane polarization to take two images, and we subtract and normalize them to see if that gives a new contrast for this tumor tissue compared to the neighboring normal tissue. So this is a schematic of how it looks like. So I was having a fun making this because I was allowed to order a lot of money to find out what are the best optimal camera for this. And this is simple system, and this analyzer contains a linear polarizer, which requires to have a very good polarization. And there's an illuminator which shines the sample. And with this, I did take some of the images, for example, basal cell carcinoma as an example over here. And to create this, this is another example of squamous cell carcinoma. By the way, basal cell carcinoma is the most popular common type of skin cancer, and another is a squamous cell carcinoma. So I took a P polarization image of the reflected one and S polarization image, and by subtracting this and normalizing them, I can create higher contrast fluorescent polarization image, either gray or color. So I had a chance to present this one in front of a number of dermatologists in Boston Medical Center. And one of the doctors told me that he was very happy to watch this. And he, in fact, to build this, the tool, it doesn't cost too much money. It's because it's relatively simple and easy geometry. However, he was telling me that, oh, if, you know, it shows some interesting results. And if you turn out to be working very well, I'm willing to pay $100,000 for this machine. And I was so stuck by this. Hey, this doesn't cost that much money to create this. And he has an entrepreneurship mind himself, and he's explaining me that to run this mode surgery, you not only need a separate laboratory to do this staining and examination, then you have to hire a staff member for doing this. To take care of this whole arrangement, actually it's a headache for the doctor. So if there's a machine like this, you just cut it and put it on top, and then just push a button, and it shows right away a quantitative image results, and which you can interpret. And that's worthwhile more than $100,000 because he's already spending more than that for his traditional ways of clinic. So this is an example. I realized that, oh, biomedical engineers tackle the medical problems by interaction with a clinician who has a lot of a real world problem, and you have your own expertise of engineering to tackle those problems. So in the end,